Should I sue whoever that made tight skinny jeans fashionable because now I think I might be infertile? There is a few possible theory. Number one, if you wear tight pants or tight jeans, you actually pull your testes close to your body. So it actually increases your body temperature. Number two is if you use tight jeans or tight pants, it actually affects the circulation, the blood circulation to your organ.
Right. Is there like a menopause thing for men?
Andropause, right?
Menopause, right. So menopause affects less than half the guys. There are a lot of factors because it can be your general health, it can be your testosterone level, and it can be your mental attitude. So you can have normal bloods, normal testosterone, poor mental health, and you still look like a menopause. I have very healthy patients who are 70 plus with very normal sperm counts. I have patients who are young with very bad sperm counts. So it's your overall fitness thing. It's not like women where at 50 you have a cutoff. Guys, no. Your general health will determine whether you go through menopause. It's more of a general health thing. It's not a specific thing. So if you're generally fit, healthy, eat well, do exercise, you can avoid it.
I saw an ad for sexual enhancement medicine. Are there any serious side effects of using them?
Expensive.
Is it expensive? I thought it's now very readily available.
Let's divide the ads into two. One is for certified medicines. That means things like Viagra. Basically all medical category drugs. These are relatively safe and we know their side effects and we can counsel and advise patients accordingly. Second category, all your Toka Ali, your multivitamins, your saw palmetto, pumpkin seed that the pharmacists want you to buy. Ministry of Health does not regulate supplements. We don't test supplements, there's very little information on supplements. So there's a huge risk with taking them because honestly we don't know anything about them. We use things that we have tested, we have checked, and I proved that it works.
Yeah. What is your next question?
Been eating the abomination that is pineapple pizzas. I love pineapple pizzas because I heard my sperm will be better. What else should I eat? Personally, I love pineapple pizzas. Actually, sperm food is really easy. Whole foods, right? So not be eating processed foods. That's your bacon, ham, sausage, lap chow. Basically, whole foods, whole grain, whole vegetables are fine. If that food is on my plate, I should be able to identify where it comes from. Support Malaysian agriculture. Eat pineapple. Okay.
I just got side-eye by someone for smoking menthol cigarette. Apparently, it causes impotence. I'm not sure why the question specifically say menthol cigarette.
Because there's a common myth. If you are already a smoker, you want to feel better than the other smoker. My Marlboro is better than your menthol Marlboro. So I'm going to die from cancer, but you are going to die from cancer and you're going to be impotent. Okay?
Regular social smoker, maybe there's no effect. Heavy smoker, in fact, also there's a lot of compound or chemical inside the smoke. The cigarette actually can damage the blood vessel, and we all know that the blood vessel is super important for the erection. Are fertility treatments painful? Can I just do it through a special diet? I leave it to you.
Okay, fertility treatment here, there's two types. There's medical treatment, which is basically medication and injections. They're not painful, they're very small injections. For those who fail all medical treatments, there's no medication that's going to help you, you go for surgery. We do surgery under anesthesia, and believe it or not, it is fairly painless. You don't feel anything during the process, and after the process, a lot of my patients go back to work. In fact, I did one yesterday and the patient went back to work in the evening. So it is very tolerable.
How often should I go for a prostate cancer screening?
That's right. For those with a family history of prostate cancer, that means father, uncles, first degree relative, we start screening at the age of 40. And depending on the blood results, you'll be repeating the bloods every 1 or 2 years. For every other guy, it's after the age of 45, and it's basically you do one blood test. If the results are very good, once every 2 or 3 years. If the results are borderline, you repeat it every year.
For normal guys?
45, once a year.
Is it normal to feel pain while urinating after ejaculating? Asking for a friend.
Okay.
Is it normal to feel pain while urinating?
No. Basically, if you feel pain after ejaculating, pain is an indication of inflammation. Inflammation in the penile urethra, the part you pee, is because something in the sperm irritates the urethra, and that's usually bacteria. So you may have a prostate infection or urine infection. Usually a simple course of antibiotics will solve this problem. Interesting questions.
Yeah.
Can I still have kids after getting treatment for testicular cancer? Okay, this is interesting. I guess I did discussion today. Testicular cancer very early stage, patients go for surgery and we just remove the cancer. Those patients, no problems. They can have children. For a lot of testicular cancer patients, they need to go for chemo. 70% of patients who undergo chemo, the sperm will die. 30% can and still have children, but you need to wait 2 years after chemo. So what we do is, for anyone who's going for testicular cancer treatment, we ask them to freeze the sperm. So we collect the sperm, freeze it. Once it's frozen, they can come back for IVF. Or after 2 years, check their sperm. Sperm counts are normal. You don't have to keep the sperm anymore. But during chemotherapy, your sperm counts will drop to almost zero and the sperms will be badly damaged.
What is the chance of the sperm count back to normal?
Less than 30%.
Will exercise boost my sperm count and quality? So normally we'll advise our client exercise moderately. Okay, you should exercise 30 minutes a time, 3 times a week. That is the best time to boost your fertility. Not only the sperm count or anything, but for both parties, the fertility. Okay, but excessive exercise, your body heat will actually affect the sperm production. I mean, for the guys. And for ladies, if excessive exercise will actually change your hormonal pattern, then can cause like amenorrhea, meaning no period or no ovulation.
I'm a tempeh loving man from Indonesia. I eat tempeh every
Local
day.
people eat tempeh,
Yeah. I eat tempeh every day. Does this mean I won't have kids because of soy? Right. I come across this question very often. So this is a soy question because soy is a phytoestrogen. So there's a theory that if you eat lots of soy, and I'm talking lots, like that much soy every day, your estrogen levels will go up and it affect fertility. You need to eat a lot of soy, and guys anyway naturally have some amount of estrogen. We convert testosterone to estrogen in abdominal fat. So go ahead, enjoy your tempeh because it is very unlikely you can eat enough to make a difference.
Does cycling or horseback riding increase my risk of getting testicular cancer?
Okay, no, it doesn't increase your risk of testicular cancer. We don't know why testicular cancer happens. Cycling and horseback, actually the question comes because those who cycle a lot, especially like marathon cyclists, because of the structure of the seat and the horseback and the compression on the perineal nerves, sometimes have sexual problems, not infertility problems.
Can a man with low sperm count get a woman pregnant?
Of course you can.
Actually, as long as you have a sperm, then there is a potential, but we are talking about chances. Okay, so of course a man with low sperm count have less chance to get a woman pregnant, but doesn't mean you are impossible to get a woman pregnant.
Try
okay,
harder.
Yeah, try more regular, harder, and more of any issue, then have to see you lah.
Yeah, definitely.
Okay.
If I had prostate cancer in the past, can I still conceive children? Cancer itself doesn't really change fertility much. The problem is our treatments for prostate cancer make you effectively infertile or impotent. If I use hormonal treatment, that means your cancer has spread, your sex drive will drop and your sperm production will drop. If I do surgery, most patients will not have ejaculation. So we can collect sperm by operation, but naturally very difficult. If I give radiotherapy, same effect. A lot of patients cannot ejaculate well and have erectile dysfunction. The treatments can make someone be impotent and contribute to infertility, but the cancer itself, no.
Will putting my laptop or phone near my crotch lower my sperm count?
Okay. Actually, this comes back to what he said much earlier. It's the temperature. It's not the radiation. It's not the device itself. If you're putting something very hot right on top of the factories that produce the sperm, increase the temperature, the factories don't work well. When they don't work well, your sperm production drops. Two things. Laptop is pure temperature. Handphone, there was a theory that radiation from the cell phones can affect testicular production. No evidence so far. Basically, if you cook your testes, they're not going to produce sperm. Laptop belongs well on the table.
Laptop belongs on the lap.
Yeah,
on the laptop.
Yeah, but I want to have babies, so I put it on the table. Okay.